I am Professor Hemanta Senanayake, the Chair Professor of Obstetrics and Gynecology in the University of Colombo, Sri Lanka. Thank you for taking your time to do our module on visual assessment of blood loss. By now, you would have done our pretest, and I hope you found it easy. But one thing is for certain, once you have completed our module, you would find it very much easier to do the post-test. Before I go any further, I want to emphasize to you that the material and the utensils that we have used in this module are the ones that we are using here in Sri Lanka. These can differ between countries and even within a country, between hospitals. Therefore, if you want to replicate what we have done, it may be advisable for you to perform a similar exercise using the materials and the utensils that you are using in your own hospital. Then it will become more accurate. Now a word about how we developed this module. We obtained expired blood from our blood bank and took the utensils and the materials and calculated how much was required to fill or soak these materials. We did this 3 times over and averaged out the volumes. And finally, we converted the volume that we got to one that is easier for you to remember in practice. For example, if we obtained a volume of 92 milliliters, we converted it to 100 so that in practice it is very much easier for you to use. Postpartum hemorrhage is one of the top 5 causes of maternal mortality worldwide, especially in the developing world. It is estimated that severe postpartum hemorrhage occurs in about 11% of women who have a live birth. About 14 million women will suffer severe blood loss postpartum, of whom 1% will die as a result. The World Health Organization statistics suggests that 25% of maternal deaths in the world will be due to postpartum hemorrhage, and this will account for 100,000 maternal deaths per year. This risk is higher for those women who are delivering in developing countries. Most of the time, maternal death is preventable when it's due to postpartum hemorrhage, and one of the main causes of this is late diagnosis. And the main factor that leads to this late diagnosis is underestimation of blood loss, and blood loss is notorious for being underestimated. Visual estimation of blood loss is used routinely in clinical settings in many countries. Visual estimation underestimates blood loss, as was mentioned previously, and this tendency is greater when the blood loss has been over 300 milliliters. And this is more for gauze swabs and towels and sheets. And it has been shown training and education on the estimation of blood loss will increase the accuracy of visual estimation of blood loss. Now, let us look at some commonly used utensils and materials. Let's look at these sanitary pads. Like I said before, these can vary from country to country, and what we have used are the sanitary pads that are used in maternity units in Sri Lanka. Could you have a guess as to how much blood is soaked in this sanitary pad? This is a fully soaked sanitary pad. This takes 80 milliliters of blood, whereas in a half-soaked sanitary pad, the volume of blood that will be taken will be 40 milliliters. How much is this? This appears as a fully soaked pad, but when you turn it around, you can see white. It is half soaked. So this is a pad that contains 40 milliliters. in a sanitary pad that is 1/4 soiled, it will be 20 milliliters. Let us now do a small exercise. What about these 3 pads? Here we have one which is fully soaked, one which is half soaked, and one which is only 1/4. So they will contain 80 plus 40 plus 20 milliliters, giving us a total volume of 140 milliliters. The kidney dishes that are commonly used will take 500 milliliters. One that is half full, therefore, will take only 250 milliliters. One that is 1/4 full will be 125 milliliters. The smaller kidney trays will take 250 milliliters. A small kidney tray that is half full will take 125 milliliters. Let us now take the bowls that are used. The large bowls that we use in Sri Lanka will take 500 milliliters. The gallipot will take 100 milliliters. Therefore, if you have a situation like this where you have a large kidney tray, a small kidney tray, a large bowl and a gallipot, the total will be 1350 milliliters. So in the practical situation, it is advisable that you get used to calculating the total blood loss, and it will come naturally to you as time goes on. Let's look at the cotton swabs again. I want to emphasize these are the ones that we are using locally. The small cotton swabs, each will take 20 milliliters. A half soiled gauze swab will be 10 milliliters, and in this instance it will be 30 milliliters. If you take the large gauze towels that are used in surgery, this will be 80 milliliters. A half soaked gauze towel will take 40 milliliters therefore. If you take in this situation, it will be 120 milliliters of blood. The general surgical towels, these are the ones that we are using in Sri Lanka. In many countries these are not used, but if you are using them, it will be advisable to calculate the amount that you would require to soak them. The ones that we use will take 200 milliliters. A half soaked general surgical towel will be 100 milliliters. Now let's look at an example of commonly used utensils that have been soaked and filled with blood. Let us now see how much blood is soaked and collected in these utensils and materials that are used in the surgical setting. First, there are 2 gauze towels which are fully soaked plus one that is half soaked, so that will be 200 milliliters. The GS towels, one which is fully soaked and one that is half soaked, will be 300 milliliters. The sanitary pads, 2 of which are fully soaked, one that is half soaked, will make it 200 milliliters. A bowl which is 1/4 full, 125 milliliters, and the gauze swabs, 3 of which are fully soaked and one which is half soaked, will make it 70 milliliters. Now it's time to practice. Let us see in a real life situation how you would calculate the loss in this kind of situation. I'm going to leave this slide on for some time. In this kind of situation, sometimes it may not be necessary to calculate the blood loss piece by piece, because it is massive blood loss where the blood is spilling on the floor, and generally we could say if the blood is spilling on the floor coming out of the bed, the blood loss is over 2000 milliliters. We would classify this as a massive obstetric hemorrhage, and the risk of death for this woman is very high. We have made a poster using our Sri Lankan materials and utensils to depict volumes of blood that will be taken by these. We find these posters to be very useful, and we display them in all our labor rooms. It will be a useful exercise for you to develop posters like this, so that there is a ready reckoner for the staff to calculate blood loss. I have now come to the end of my presentation. You may keep going back to the slides that I have shown you, and when you are confident about the content of the lecture, you may proceed to the post-test. If you are able to score 80% or more, you will be able to print out the certificate to prove your successful completion of this module. We would also be very grateful if you would take a few minutes off to complete the feedback form. Thank you for completing the module on estimation of blood loss. Thank you once again.